Hello and good morning. Happy Monday, everybody. So today we have a class. Oh, sorry, good afternoon. Well, it's morning for me, 'cause that's when I'm doing the class, but good afternoon, everyone, and happy Monday. Um, so we're doing a class today on it's something that's in the news and it's important that we stay up on it. So I'm going to go over what the COVID variant Omicron is and what's going on with it and what we need to watch out for. Because right now, Dr. Fauci, who's like the leading expert on this in the country, says that we should brace for a tough few weeks to a few months. So it could be like 3 weeks, 2 weeks, 3 weeks that we really need to kind of be careful. And of course, it's during the holiday season, so it's tough for people. But also possibly maybe a couple of months, so maybe up until February or possibly March, that we're really going to have to buckle down again and get this thing under control and do everything that we're supposed to be doing. So let me go over, I'm going to kind of skim and go over the important points. So I'm not reading this entire article, but it's basically just on give me one moment. Okay, so here we go. So the U.S. is likely in for a hard winter as the Omicron variant of COVID-19 spreads rapidly. And it's straining a healthcare system that is already battered by the Delta variant, which just means hospitals are really kind of overrun. People are actually not going to the hospital for serious conditions like heart conditions, things that might have to do with cancer, things like that. Very difficult things to deal with, but they're staying away from the hospital because they really feel like, oh no, that's not a safe place to be. And that's where we're at right now. And so it's kind of a frightening spot. And so, according to Fauci, it's going to take over. So, right now, people are being urged to get vaccinated and, of course, get your booster shot. A lot of people are also saying that the booster shot, really, it should have been a 3-shot series. It shouldn't have been like, oh, let's have 2, and then, seeing how it goes, then we should have a 3rd. Really, it should have just been prescribed as a 3-shot thing. So please, if you haven't got your booster, go out and get your booster. It really helps protect you against the virus. One sec, sorry, hopefully last interruption. So, and be prudent with everything else that you do. So when you travel in your indoor settings that are congregated, wear a mask. And it says we can't walk away from that because with Omicron that we're dealing with, it's going to be a tough few weeks to months as we get deeper into the winter. So according to the WHO, World Health Organization, cases are doubling every 1.5 to 3 days with documented spread. In the U.S., it's expected to become the dominant strain in the coming weeks. So Delta is still going to be right now is the dominant strain. What's going to happen is that Omicron, though, eventually is going to take over, and it's really spreading quickly throughout the country. It kind of started, thinking a lot of going on in England, but then it kind of hit the East Coast, and it's definitely got all the way here to San Francisco. So the U.S. is now facing a resurgent coronavirus as the pandemic marches into its 3rd year. The country was averaging 126,967 new cases per day as of Saturday, according to data from Johns Hopkins, up from an average of just over 70,000. So we're getting close to double the numbers again. So it's spiking again. So the Omicron variant is extraordinarily contagious. So which is not good news. That it means it can spread a lot faster. It's contagious as the measles, and that's about the most contagious virus that we've seen. And that's right. So, and warning that there was going to be a tsunami coming for unvaccinated Americans. It means if you're unvaccinated, this is like the measles. It's alright, buddy. Everybody's on the move. It's a good thing. And the measles was really bad. That was one of the worst things that we had, and it was very dangerous. So scientists say it's too early to tell whether Omicron causes a milder form of COVID-19, but regardless, it will put pressure on the healthcare system. So they're saying they're not sure. Maybe there won't be as many deaths, but there still could be loss of taste and smell and things like that. And so why would we go into battle with a completely unarmed, said Reiner professor. So our vaccines will protect you, particularly if you are triple vaxxed. People who are unvaxxed should start the process now. Go ahead to your pharmacy and get vaccinated. It's important to remain vigilant to help prevent hospitals from getting swamped, he added. Well, they'll probably go into what I was just thinking in a bit. So even if Omicron ends up causing less severe infection than the Delta variant, the sheer number of infections Omicron could generate could overwhelm U.S. hospitals. So more than 69,000 people are hospitalized with COVID-19 across the U.S. More than 20% of all ICU beds are occupied by COVID-19 patients, according to the U.S. Department of Health and Human Services. That's a lot of beds. So we need to protect our healthcare system, Reiner said, and that's what every American needs. Why every American needs to vax up right now, because our healthcare infrastructure is at stake right now. President Joe Biden will meet with his COVID-19 response team regarding the latest developments with the Omicron variant, according to the White House. And so the next part of the article says, don't wait to get a booster. According to the CDC, about 61.4% of the total U.S. population is fully vaccinated. And about 32.1% of fully vaccinated adults, so out of that 64%, about 32.1%, roughly half, have received a booster, which health officials point to as a crucial line of defense against the Omicron variant, and that there are many who are eligible for a booster shot should not have gotten one. Should have not gotten one. Sorry. And yet many who are eligible for a booster shot have not gotten one. So there's a lot of people, I think there's confusion, like, oh, maybe I shouldn't get my booster. It's for this group of people, it's for that group of people. No, you should get yours. They want you to. Yeah. I'll get into other stuff when they don't. But when you so get your boosters, basically what they're saying. So unvaccinated people face 20 times greater risk of dying from COVID-19 and a 10 times greater risk of testing positive than fully vaccinated people who have also received a booster, according to data recently published by the CDC. A big message for today is if you've had vaccines and a booster, you're very well protected against Omicron causing you severe disease. So anybody listening to this who is not in that 60% of Americans who are eligible for a booster but haven't yet gotten one, this is the week to do it. Do not wait. Please, like they said, it's the next few months. This is the week to go out and get your booster shot. If you're part of the 61% that have got your initial 2 doses or your 1 Johnson & Johnson, this is the week to go out and get your booster shot, the 3rd shot. And do it today if you can. I wouldn't wait till Christmas. You don't want to feel terrible for Christmas. Because I didn't have a good time with it, but a lot of people say, a lot of people say that basically they don't feel anything, but I wouldn't bank on that because I feel terrible. I did with every single one. The first shot was not so bad. The rest of them have been horrible. Um, so I'm gonna quickly go over this, but New York again tops record for daily new cases. So New York is in a bad way. Like Saturday Night Live, which is filmed in New York, they usually have a musical guest and a live crowd, or they have since they could. And at the very last minute, because of all the cases, they decided to not have the guest singer or the guest musical guest. That's what I'm trying to say. And they also canceled the audience. They're just like, no, it's not worth it. So right now, Governor Kathleen Hochul's office reported 22,478 positive cases Sunday, up from 21,908 positive COVID cases on Saturday. And that's just one day. So yeah, that's a lot. They do say this is not March of 2020. We are not defenseless. So what we want though is we want to avoid and really give our best thoughts and hopes to people in New York City that they're doing okay. But we also don't want to end up in that same predicament. So that's why it's the best thing to get the booster shot. It's the best thing to it's the best thing to stay masked up, wash your hands, socially distance as much as you can. I know it's the holidays and so it's tough, but do the best you can. Stay safe. You don't want to be in the hospital. I promise you. You can have one visitor, I think, and that's it. So please be careful. Oh yeah, and the lines for getting tested are hours long lines just to get tested for COVID-19 right now in New York. Like they're just spread all the way down. It's kind of like, but much less happy with like Star Wars when it first came out. It's kind of like that, but except for people are trying to get tested to make sure that they're okay. And that doesn't mean that they're necessarily feeling ill, but I think people need to get tested anyway. Just like me, I get tested every month, and so we got to be careful with this. So there's it's really important that we're looking at this Omicron variant and taking it seriously so that we can get out of this. But if people don't take it seriously, we're not going to get out of it. We've got to keep doing what we're doing to stay safe. As much as we don't like to hear it, I think it's still the truth. It's our reality right now. But we can change reality, which is good. So hospitals are impacted and bracing for more. So in Maryland, it looks like, hospitals are up about 150% over the past 2 weeks. California health officials said Friday we're seeing hospitalization numbers begin to trend upward, stressing the need for vaccinations and boosters. In New Jersey, we're going to see long lines outside of our testing clinic, more demand than we've ever seen for months for testing because folks are getting sick. Hospitalizations have doubled over the past 2 weeks, and although 46% of those hospitalized earlier this week had been vaccinated, they had not had a booster shot. So they're just really pushing. Go get your booster. Oregon officials forecast a grim early 2022. So it's everywhere. And scientists are still working to gather information on how severe the Omicron variant is. Data from 2 weeks of South African cases appeared to indicate Omicron was milder in severity, but in the United Kingdom, epidemiologists said last week they found no evidence Omicron is causing milder disease there. Although the Imperial College London team also said there was not much data to go on yet. So, and the way it is too is they have to make sure they know this is what the variant is, and they have to be able to isolate that. And then on the other hand, what they have to do is they have to be able to, once they've isolated that part, then they have to say, okay, now that we've got these, and we're sure this is Delta and this is Omicron, what's the difference? And a lot of times, it's hard to mix and match that and really know for sure exactly what you're doing. So they're doing their best right now. And also, last thing, when it comes to hospitals, because they're so overrun, there's a lot of people quitting their jobs at the hospital because they're stressed. And, the best way that we can help our healthcare workers or emergency medical professionals is to go get our vaccinations and get your booster shot. Protect yourself so you don't have to be in the hospital. Free up those beds for people who really need a hospital bed and not stress out an already stressed system. Because it's got to be really difficult. I mean, a lot of people say, hey, my life is really impacted because I have to stay home. And I don't get to go out to the places that I want to go to. Imagine what it's like being a healthcare worker, where you go to work for maybe 8 hours to 10 hours, maybe more a day. You eat, you sleep, and then you go back and help people that are not feeling well all over again. All day. Every day. So you might say you want to go out, but do you want to be doing that? Life isn't just about fun right now. We really need to think about everyone else and what they're going through. If you can stay home and be well right now, that's a really good thing. It's a really good thing that you can stay home and be well. Your mental health is the most important thing. Take care of yourself mentally. Meditate. Call people maybe that you wouldn't call. Just, wish people happy holidays when you see them. Just little things here, but just know there are people out there that are really going through a tough time. All of us are going through a tough time. But just remember, there are people that are really trying to help and are doing an amazing job. And it's our job to help them out by doing our due diligence, staying home socially distanced, and just be careful. Take care of yourself. So that's the class for today. Sorry, it's a little serious, but I want to make sure that we're taking care of ourselves. Okay, I miss y'all, and I will talk to you soon. Please, if you have any questions, comments, concerns, more information than I have right here, please let the group know. Let me know. I'll look into it, and we can do more on this. Anyway, ciao for now. I'll talk to y'all later. Have a great rest of your day.